Hi, today we'll be speaking about the respiratory syncytial virus, which is known clinically as RSV. And I'm Mandy Colsey. So first, a few interesting facts about RSV coming from the CDC. It's the most common cause of bronchiolitis and pneumonia in babies under the age of 1, as you can see in the graphic on the right. It leads to over 57,000 hospitalizations and 200 deaths in young children each year in the U.S. It's even more deadly in the elderly, causing 14,000 deaths annually. The virus becomes very widespread during certain seasons because it creates no long-term immunity. So it's possible to be infected with RSV more than once in a season. 40% of infections in children under the age of 1 will result in bronchiolitis.
Hi, my name is Joseph Pitts, and I'll be talking about the etiology of respiratory syncytial virus. Respiratory syncytial virus belongs to the Paramyxoviridae family and is of the order Mononegavirales. The same order as Ebola, Nipah, measles, and mumps, which are non-segmented, negative-strand RNA viruses. RSV has 10 viral proteins. 2 of the surface proteins, the fusion and glycosylated attachment proteins known as F and G, allow the virus to attach and fuse to host cells. When the host cell is initially infected, these surface proteins cause a small antibody response to fight off the infection. Cytoplasmic inclusion bodies are the location of viral RNA polymerase. RSV varies in shape and size. It can be spherical, filamentous, or a combination. Its size is from 80 to 350 nanometers in diameter, making it a medium-sized virus. It has a helical ribonucleic capsid and a plasma membrane-derived lipid envelope. RSV is of 1 serotype and 2 strains, the A and B, A being more severe. Now I'll be talking about RNA replication and transcription. Replication in RSV is directed by the N, P, and L proteins. The helical nucleocapsid and polymerase being the catalyst, enter the host cell's cytoplasm. Replication generates a complement positive sense RNA called the antigenome, which becomes the template for genome synthesis. Transcription occurs only when superinfection of RSV is present.
Okay, and I'm Mandy, and I'll talk more about the signs and symptoms. So the signs and symptoms can vary widely, and how a patient presents and the severity of the symptoms depend on the strain of the virus, like Joseph talked about, and the risk factors of the infected individually. So initially, in most people, RSV appears as a cold-like illness with nasal congestion, runny nose, mild cough, low-grade fever, sore throat, or a mild headache. So those are the most common symptoms in older children and adults with no risk factors. In severe cases, the infection can cause things like croup or an ear infection, otitis media, and it can spread fairly quickly to the lower respiratory tract, which is when we start to worry about it. It can cause bronchiolitis, especially in younger infants, or even pneumonia. So the signs of a worse infection include a high-grade fever, wheezing or the ryle sound in the lungs, tachypnea, which is breathing really rapidly, severe cough, decreased appetite, and then they'll use, especially babies will use accessory muscles to breathe, or they'll have short, shallow, rapid breathing. And also sometimes there'll be some nasal flaring with each breath. The most worrying thing is when you get things like cyanosis, where they turn blue from lack of oxygen, or apnea, where they stop breathing altogether. Symptoms usually last 7 to 10 days total, but peak occurrence for RSV is between 2 and 8 months of age. So that's where most people will get it. And virtually all children will have RSV at some point. The interesting thing is males, for whatever reason, are twice as likely to be hospitalized for it than females, which is kind of interesting. A couple other signs and symptoms that can manifest are when we consider sepsis, if they get a blood infection. And that can give you things like tachypnea and tachycardia. So they're breathing fast and they've got that fast little heart rate because they've got a really bad infection. And then also dehydration is a big concern. And the biggest sign for dehydration is, or the symptom for dehydration is dry mucous membranes and failure to produce tears, things like that.
Hello, my name is Carla Kendall, and I'm going to talk about how RSV is transmitted. RSV is spread from person to person by way of respiratory droplets when they come in contact with your eyes, nose, or mouth. RSV can survive on hard surfaces such as a doorknob or handrail for many hours. It survives on softer surfaces such as tissue or hands for a shorter amount of time. This is why it is important to remember proper prevention techniques to reduce our transmission of RSV. After exposure to RSV, the incubation period is 2 to 8 days, with the mean incubation period being 4 to 6 days. The incubation period in each person can depend on several factors, such as the age of the patient and if RSV is the patient's primary infection. So this is a picture of my son. He had RSV when he was 6 months old, and he was actually hospitalized because of the RSV for a couple of days. And when he was finally healthy enough that we could take him home, we were sent home with an oxygen tank and this little vacuum thing that we had to try and clean him out with. But he was one sick little kid from this virus. So once a person is infected, according to the National Center for Biotechnology Information, or NCBI, once the virus is contracted, RSV spreads rapidly from the infection site to the respiratory tract, where it targets its preferred growth medium, apical ciliated epithelial cells. There it binds to cellular receptors using the RSV-D glycoprotein, then uses the RSV-F fusion glycoprotein to fuse with host cell membranes and insert its nucleocapsid into the host cell to begin its intracellular replication. Host-inflammatory immune response is triggered, including both humoral and cytotoxic T cell activation, and a combination of viral cytotoxicity and the host cytotoxic response cause necrosis of respiratory epithelial cells, leading to downstream consequences of small airway obstruction and plugging by mucus, cellular debris, and DNA.
As far as reservoir, the only reservoir for the virus is actually humans. And interestingly, some children and individuals with weakened immune systems will continue to act as carriers of the virus for up to 4 weeks after they stop showing symptoms.
Hi, I'm Cindy, and I'm going to be doing the section on prevention and treatment. So we're just going to start with prevention. So I've divided just into 2 parts of it, when you're the one who's sick and when you're the one who wants to avoid getting sick. So when you're the one who's sick, just to help prevent that disease from spreading to other people, one thing you want to do, because it is an airborne disease, when you cough or sneeze or do anything like that, you want to cover your mouth, either by using a tissue or a cloth, or a popular method is just by covering your arm with what's called the vampire method, is how they've been teaching. It's just covering your mouth with the upper part of your arm, just like a vampire does with his cape. Another common thing that you should probably do is just try your best to avoid others. So typically just stay at home, stay in bed, try to avoid contact with other people. But if you do have to go out, just do your best to avoid people who are considered at higher risk than the average person. That's typically children, pregnant women, elderly, or people who you know have a compromised immune system. So just try to avoid close contact with them as long as you can. And for people who are not sick but want to try to prevent getting sick, try to avoid as much physical contact with those who are sick as well as you can. You want to regularly wash your hands with warm water for about 30 seconds. The typical thing that they teach kids now is to sing the happy birthday song. And one important thing is to make sure when you do wash your hands, to make sure it's with warm water. studies do show that washing your hands with just warm water will actually kill more germs than it would just washing your hands with cold water with soap. And you want to avoid touching your face and with unwashed hands as long as you can. And just make sure to clean all areas that might be contaminated by someone who's sick, you know, countertops, doorknobs, phones, remote, just anything that they would touch consistently with their hands. Just another thing that they're working on with prevention is they are researching a vaccine, but right now it's not available right now, but they're still working on it. And I did find in the CDC that there is a drug called palivizumab. It's available, but only to prevent severe illness in certain infants and children who are considered more at risk than regular children, typically children with a heart disease or a lung condition. The drug can help prevent the disease from getting serious and more life-threatening stages, but it can't help cure or treat it if they're already suffering from the disease, and it can't prevent it in general, but they are working towards it. So typically when it comes to treatment, there are 3 different kinds of categories: supportive care, immune prophylaxis, and antiviral medications. So supportive care is typically what's done in the home when the symptoms aren't that severe. Just make sure to avoid being dehydrated by taking plenty of fluids, take acetaminophen or ibuprofen to help with the aching. Make sure to follow the instructions on the medications when you take it. Sometimes using a humidifier will help make the breathing a little easier, or to help clear your nasal passage, you use a bulb syringe, as you can see right there on the presentation. You just squeeze it, you place it into the nose, and you just let the pressure squeeze some of the mucus out to make it easier to breathe. Sometimes saline drops also help with this. All right, so immune prophylaxis is basically just prevention or treatment of disease by the production of active or passive immunity. So basically the immune prophylaxis is palivizumab, basically a humanized monoclonal antibody with activity against the RSV membrane fusion protein required for fusion with host cell membranes. It has to be administered monthly for the duration of the RSV season. Unfortunately, right now it is not incredible, but it is quite expensive. And typically right now, the only people who are believed that could justify the cost of it are children who are about a year or younger, and even then only if they have these symptoms such as chronic lung disease, congenital heart disease, neuromuscular disorders, or if they're premature. So with the price, those are the only conditions that people right now typically believe would justify the price of this treatment. Antiviral medications, as I mentioned before, this is the only thing. Yeah, as before, this medication is the only thing approved by the United States. Unfortunately, it's still very expensive. So it's really considered a controversial issue, not just because of the expense, because the danger to healthcare providers, the questions of efficiency, and the length people have to stay in the hospital. And so that's pretty much it.